Hello, sir. My question is, what is the present healthcare system in India, and how is it different from other countries in the world? And what do you feel for our society? What do you feel is the better healthcare system?
Dr. Natesh, we all during medical education, my education was half a century ago. I joined medicine in 72, and you're all much more recent. But in some form or the other, we all have studied community medicine, social and preventive medicine. I don't know what it's called now. So there is a standard format given. But what the books describe and what actually is happening in the country, unless we see the distinction, we'll be misled. On paper, we have a robust system, a primary health care, PHC, sub-centers, then community health centers. In states like Andhra Pradesh, Telangana, area hospitals, slightly larger, sub-district hospitals, then district hospital, then teaching hospital for tertiary care. But in reality, A, most of them are underfunded, hopelessly inadequate. B, there is no integration of primary, secondary, tertiary care. So the first point of contact for most patients is tertiary care, or a private doctor in private practice, or even more tragically, a quack, an unqualified person doing some kind of voodoo medicine and hoping that you get something out of that. And therefore, overcrowding of the teaching hospitals in cities because there's no other primary care system available. You go to the accessible point. So All India Institute of Medical Sciences gets 12,000 patients a day, the world's highest number. The nation's Apex Institute gets 12,000 outpatients a day. It's absurd. Your teaching colleges typically in India get about 2,000, 3,000, 4,000, 6,000 patients a day. So the system is completely lacking in integration. It's all isolated, whatever is there, very, very random. The third is the public expenditure is one of the lowest in the world, and out-of-pocket expenditure of the patients is one of the highest in the world, in fact the highest in the world. As a result, the number of people who become poor on account of inadequate health care is extraordinary. That number is larger than most nations in the world. 6 crore people in a year, 60 million people in a year become poor when they were not poor in the beginning of the year only because of bad health care. So overall, we have some great strengths. Doctors like you, every year we're producing 80,000-90,000. We have some outstanding clinicians, and our high-end interventions are at very low cost compared to global prices and at global standards in terms of safety and the record of relief, etc. Our pharma industry is a world champion, so we have a lot of grades, but we have absolutely third-rate healthcare system which is not serving our people. So therein lies the opportunity. There is a need, desperate. There is also a great opportunity because we can do things much better than most countries in the world.
So what do you suggest the change should be there? What changes have to be done to the existing healthcare system?
No, in medical training, we are all taught the importance of diagnosis. The most important thing is understanding what is the problem. Otherwise, we give random prescriptions. What's happening today in the country is random prescriptions. The union government, states, they say we'll start more medical colleges. You keep seeing headlines. Actually, that's not the problem at all. Many people who are outside medical profession or outside the healthcare sector may find it surprising. We have about 1.2 million, 12 lakh doctors, qualified MBBS doctors in India. We are producing about 90,000 to 1 lakh doctors every year. We don't require more doctors at all. We require these doctors accessible and better oriented towards taking care of the needs of our population at various levels. It is not more doctors. More doctors don't make any difference at all. Already existing doctors, probably about 250,000 of them, 250,000 of them, in my judgment, are either underemployed or unemployed. It takes genius, great genius, to design a system where you have many people who require doctors. You have many doctors who don't know what to do. What a mismatch, what a tragedy. Yes. So the problem is not lack of doctors. No. First we must understand what not to do. The random approaches, or you suddenly spend 100 crores or 200 crores on one nice diagnostic center or something else. All these are necessary on paper. But that's not where the money should go, not in a random manner. There must be a proper integrated structure. A must be accessible. Everybody in India, the rich, the poor, the villages, the urban areas, without any burden on the pocket, they must be able to access healthcare. B, it must be effective. It must not be a voodoo health. It must be real healthcare that actually improves the quality of health and reduces expenditure for them. C, therefore, it must be affordable, both for the individual and the country. Because healthcare expenditure, it's a bottomless pit. You take America, America spends about 18% of the GDP on healthcare. America is the richest country in the world. And then in that country, about 1/5 is spent on healthcare. Half of it by the government, half you and I, the citizens, pay for insurance premiums. But America is nowhere near the top in healthcare outcomes. Expenditure-wise, it is top. Probably it is twice or thrice the second highest spending country. But outcomes-wise, it is 35th or so. It is the way you design it. You put more money, but how you design it is more important. Otherwise, healthcare expenditure is a bottomless pit. No society can afford it. America is worried. Britain is worried. France is worried. Germany is worried. Australia is worried. Canada is worried. All rich countries are also worried about healthcare expenditure. So we must design it intelligently. We can go into a little more detail, but basically, we have looked at some things. In a brief discussion we have seen, Natesh, we have plenty of doctors. They're reasonably well trained, though the clinical skills could be better. We have tremendous clinical material, but clinical skills can improve. That's a matter of training and some orientation. We have very good quality infrastructure in public and private sector, diagnostics, as well as the pharmaceutical industry and the private sector hospitals. Today in India, annually we are getting about $14 billion of income serving the overseas patients. This year we expect 1 million patients to come to India and get healthcare treatments, high-end surgeries and other interventions. And India is going to earn about 1 lakh crores, $1 trillion. Good. We can actually reach 100 billion, 7-8 times more. But that does not help our people. I'm all for it. I'm all for earning more money by providing services to the rest of the world. But simultaneously, we must design a mechanism by which our people get quality healthcare at an affordable cost. So what it means is leverage our strengths. Don't look at phenomenal expenditure. We don't have that kind of money. Our governments are very poor. They're always starved of resources. So with a low cost, how do you get high impact? So what I believe we should do is look at each sector in isolation, separately, but in an integrated manner. The primary care, the first point of contact. I'm not talking about public health, water supply, sanitation, sewerage, immunization. Some efforts are going on, they can be improved. But I'm talking about the medical care part of it, the primary care. The present system simply is not serving the needs. When we have hundreds of thousands of doctors available, if only you provide a mechanism by which A, the doctor is accessible locally, B, why should the doctor come? After all, these are very highly trained people, some of the finest youngsters in this country. Medical entrance is a highly competitive thing. Every year I think 10, 15 lakh, 20 lakh people in the country appear for those examinations. And to get a medical seat is a great source of joy for those families. So unless there is a reward, they will not come. So there must be adequate return for the doctor, commensurate with the training and skills, and there must be competition to ensure accountability. Competition among providers and choice to the patient, because if you say, no, I'll put them as government doctors, I'll give them a monthly salary and they'll work, we have seen it all. People have no faith in that.
Yes.
And all this must be in a cost-effective manner. It must include also diagnostics. Now, for each doctor, if you want to have diagnostic laboratory, the cost will be impossible to meet. It's not economical. Yes. You must figure out a mechanism by which you can pool them. And then there must be prescription drugs available. Yes. Without any expenditure out of pocket. Again, for each doctor, if you want a dispensary, it's impossible. So you have to pool them. All this basically means the first point of departure should be identify small towns. In all of India, probably you require about 10,000 such small towns. 8 to 10,000 such small towns. In states like Andhra Pradesh and Telangana together, you probably require about 400 to 500 such places. In each small town, which is already with urban amenities, encourage young practitioners, medical doctors fully trained. You can give them some orientation, a month's orientation, just so that family practice. Now, in all medicine, we are taught all sophisticated stuff. I remember in my clinical medicine, the first thing we were taught in those days was mitral stenosis, rough and rumbling, mid-diastolic murmur and so on. It's all nice. But in common family practice, you don't require to really bother too much about those stuff. Not that you should not learn mitral stenosis or regurgitation, but you have to basically understand the disease profile of the population. At the first point of contact, what you should look for, how you should manage, and when and where and how you should refer. So that orientation is important. Once these, let's say in a small town like that, for a population of lakh and lakh and a half, about 10 or 12 doctors are available like that. You must provide a mechanism by which per month they get a net income after expenditure of 1 lakh rupees. And for a young doctor, early on, 1 lakh rupees per month is a decent income in my opinion, net income. And after some years of doing that, if they feel that they can do post-graduation, already we are providing facilities in post-graduation, these in-service candidates get preference, or they want to do private practice, or they acquired enough skills and they want to do something corporate, it's perfectly okay, because every year we're adding 90,000 doctors in the country. So there'll be a circulation. They get trained, they hone their clinical skills, people get care, they get adequate income, and they get income only on the basis of the patients coming to them. Because there are many practitioners available, patients choose whether they want Natesh or Dinesh or Tejaswini. You're not forcing them to go to anybody. We make a choice. Therefore, their reputation, the quality care they provide is what is going to give them better practice. So there's a competition, there is choice. And then ensure there's a referral service. And for all these 10 doctors in that small town, ensure there is a diagnostic center. High-end diagnostics like in Andhra Pradesh now, you can devise a mechanism by which public-private partnership is there, cost-effective but quality diagnostics. And dispensary for all these 10-12 practitioners, the free dispensary, the government control, not necessarily government owned, so the drugs are supplied. So all this can be organized and it will dramatically change healthcare scenario. Okay. Secondary care, what we are doing, just expand it a little bit. Your Aragyasri, your Ayushman Bharat, whatever, you have to expand it, make it universal with certain changes. Tertiary care is where you have to do a lot of thinking, because you have hospitals which are hopelessly underfunded. So the challenges are how to fund them adequately, and two, how to bring back the credibility. The public trust and credibility which were there when we were students, the government teaching colleges were the best. The doctors are highly regarded. Today, I don't think even middle classes are going to government colleges, teaching hospitals, whatever be the reason. So we have to bring back the credibility and trust. Fine, brilliant practitioners, reputed practitioners like all of you, must be encouraged to come back here, not on regular basis, not for a salary, but you do your own private practice, but come here as a consultant, give X amount of time, because teaching is a very prestigious thing. So the finest practitioners, they are gratified to come and teach. So give them that opportunity, a reasonable system, a contract by which their services are provided, so that the teaching hospitals and government get the service of the best. And they must be the centers of tertiary care in government. So a very well-designed system at a moderate cost with integration, accountability, and cost effectiveness. It's possible to design. That's the purpose of this kind of a thing. It's not something beyond our imagination. It's not something we cannot afford. If I say, I want 10 lakh crores a year, of course, other countries are spending much more money. We don't have that money. Just because you and I shout from rooftops, you're not going to get that money. So what is affordable? What is possible? All this is possible at 0.4 to 0.5% of GDP. Other countries are spending 10%, 12%. I'm saying we are spending now 1%. Just add another 0.4 or 0.5, but properly. Design it well. You will see a radical improvement.
Hi, this is Taman.
Hi, this is Shraddha Das.
Hi, I'm Priyadarshi. Nenu Adi.
Hi, I'm Kashish Vora.
Hi, name is Sri Vishnu.
Hi, this is Aditya.
Hi, this is Naga Anvesh.
Please subscribe to Social Post.
Please subscribe to Social Post.
Please subscribe Social Post.
Please subscribe to Social Post.